5s. You had a 6 on 15. So we'll go back over and look at all that. But you have been doing what you're supposed to be doing.
I have.
Good.
Tell me the stuff that I've been using. The
chlorhexidine rinse is the chlorhexidine gluconate. It's a broad spectrum antimicrobial rinse, but once again, we don't want you on that for a long time because I don't want the bacteria acclimating. All right, that's kind of our big gun. So we want you off of that as soon as possible. And so just like I said, the Listerine or Crest Pro Health, anything else with an antiseptic property will suffice.
Oh, great. Okay.
Especially since you've been doing what you're supposed to be doing and you're keeping your mouth cleaner.
I am.
And paying attention to your home care.
I am. Okay? And do you need, if you fast, like for 24 hours, do you need to clean your teeth if you're fasting?
Yes, you do. You do? As a matter of fact, it wouldn't matter because of the bacteria in your mouth and the microscopic debris. It's called plaque biofilm, and it actually, after a cleaning, will start to rebuild within 30 minutes.
Oh, really? Wow.
That is correct.
And so even though I cleaned my teeth before I started fasting,
you still
need to do it when I'm fasting.
That's correct. That is correct.
So all that bad bacteria and all the parasites and microbes that are in there are bad news if they build up.
That's correct.
Well, it's funny, since I've been cleaning my teeth, I think the infections are going down. I don't have that horrible catarrh all the time. When you're trying to clear your throat, I thought it was coming from my sinuses. But since I've been doing that and cleaning the teeth, I think there was the infections in the gums that was creating all that stuff.
Yep, that's very true. And not just there, it's a lot of systemic research to the systemic implications as far as diabetes, heart attack, stroke, things like that. Even low birth weight in babies for pregnant women.
Really?
Yep. Okay, so you have been doing what you're supposed to be doing.
I had. My gums are all nice and pink.
Good.
No more bleeding in my gums when I'm brushing.
Good.
Or flossing.
Do you feel a difference?
I do. I just health-wise I have more energy.
Okay. Do the tissue isn't as irritated?
Yeah, it's not as inflamed. It doesn't hurt anymore.
Good. What I'm doing is just reprobing. We're going to ascertain if there's a difference from the first time and the first steps that we took to the finishing of the scaling and root planing. Okay, go ahead and turn toward me. Thank you. Okay. This is where we had the 6. It's good. I'm not getting any bleeding either, which is also an indication of health. Alright. Left a little bit, please. Left. There we go. Okay. Very good. Okay. This is good. Okay. So obviously, you remember the first time we were in, the redness of the tissue.
Mm-hmm.
You see how it's this pink now? Mm-hmm. It's kind of like a coral pink almost. There, but once again, knife-edged, nice smooth margins. They're nice, and then these sections in between are called papilla, and those before were puffy, and they filled in this little triangle between these teeth. And see now how they're not filling in? They've just dropped very nicely in there. They fit right up against the embrasure space of these teeth. That's exactly what we're hoping for. Also, your probe depths are showing marked improvement. I'm getting at least a millimeter difference than they were. You still have some that are deep, and they may always stay deep. But as long as the tissue around it is healthy, we can at least maintain that. So that's good. And there was no bleeding on probing, whereas when you first came in, there was generalized bleeding.
Yeah.
So that's also an indicator of your oral health. So you're doing a good job. You're doing what you're supposed to be doing. If you constantly maintain your oral health care and take the steps that are necessary, you can maintain this and maintain your oral health. Now, what we'll do is we will see you and we'll put you on what's called periodontal maintenance. We'll see you every 3 months to make sure that you are maintaining.
Okay.
Okay? I'll check probe depths every visit. We will ascertain where your home care is standing, plaque level, calculus level, things like that. Make sure that the tissue has responded and is continuing to respond. And we'll go from there. All right?
That'd be great.
You do that the first year. And then I generally, if you guys maintain, then I feel confident after that first year bumping you to 4 months or 6 months.
Okay.
Okay?
Great.
All right. Now what I'm going to do is just finish by polishing you up.
Okay.
Going through and make sure we got everything, and then you will be free to go, young man.
Okay.